everyone. This is Dr. Jessica Conwin, PharmD, and I'm the thyroid specialist at Bethel Pharmacy. And I have some exciting news for you all. I will be doing my webinar, Know the Truth About Thyroid, this Thursday at 8 p.m. Central Standard Time from our Facebook page. I'm going to do it on Facebook Live. So you guys can tune in from your home and be able to get this information for free. And so I wanted to let everyone know some things that could be happening in your body that could be thyroid that may be being missed by your doctor or your healthcare provider is inability to lose weight or keep gaining weight. That is such a huge miss. Women are oftentimes told, oh, just hit the gym harder or eat less calories. And then you've got women, they're like, oh my gosh, you want me to just eat air? Because I'm living on salads and I just gained 10 more pounds. If that's you, you want to tune in to this webinar this Thursday because I'm going to explain why that is and how I can fix that for you. Some other things that are thyroid symptoms is the fatigue. This is not a normal fatigue, like you sleep and you don't have restorative sleep. You can sleep 10 hours and then you can want to sleep 10 more hours. Like you never feel rested and you're always tired. That's a big sign that there could be some thyroid dysfunction. More symptoms of thyroid is cold intolerance or sensitivity to cold, hair loss. Women will complain of their shower drain always being clogged, hairs on the floor in counter, hair is coming out in the brush and you're losing hair by clumps. That's a big sign there's something going on with your thyroid and it shouldn't be ignored. Allergies. Forgetfulness, like always losing your keys, forgetting how to spell common words, brain fog. A lot of these thyroid patients will feel like they're in a cloud, like almost like you're in a dream, like you're just watching life pass you by. Definitely could be thyroid. Muscle cramps, stiffness, constipation. If you don't eliminate your bowels 2 to 3 times a day, that is not normal. Your bowels are not clearing regularly, and we definitely need that to be happening for your detox ability. So yes, constipation is a big sign that could be something going on with your thyroid. Acid reflux. Yeah, a lot of people kind of ignore this and just keep popping antacids. But if you have chronic acid reflux, there could be thyroid dysfunction that's causing that. Bloating. Especially after you eat high protein meals, that could be thyroid. Rashes, food sensitivities, all these, I'm just listing off symptoms of thyroid so you guys can see how important thyroid is. Joint pain, loss of ambition, dry skin, brittle and breaking nails, depression. And let me stop here on depression because a lot of people are taking antidepressants and they're not resolving the depression. Thyroid and mood disorders they go hand in hand. A lot of people that have thyroid dysfunction are anxious, they're depressed, they're irritable, they have mood swings. So if you know somebody who is depressed, you want them to tune into this webinar. Anybody that has any of the symptoms that I've just listed, you need them to come on to Facebook Live and watch so they can learn why they possibly have these symptoms and how to fix them. Menstrual irregularities. This is another big one with thyroid. A lot of women that have thyroid dysfunction will have horrible menstrual cycles. Like they bleed heavy. They need to change their pads or tampons every 1 to 3 hours. Like they soil their clothes, their sheets. If that's you or has been you in the past, that you used to bleed this heavy and now you've had a hysterectomy, you definitely want to tune in to this webinar. And let me say this, if you are a woman or you know somebody who has had a hysterectomy, I'm finding a trend that a lot of women that have had a hysterectomy usually have thyroid issues. And it's the unresolved thyroid issue that is what caused them to have the hysterectomy. And so whatever the reason of why you had the hysterectomy, just by removing the uterus and ovaries doesn't resolve the issue. Whatever's going on in your body that made you have the hysterectomy, it's still there, and we still need to address it. So those women, you want them to tune in too. Anyone that's had a hysterectomy, anyone that has menstrual irregularities where they're bleeding very heavy, they need to tune in. Infertility. This is another big one. I'm so passionate about thyroid, and this one just breaks my heart because you see women that have reoccurring or miscarriages where they keep having incomplete pregnancies, or they have a difficulty conceiving. Those women need to have their thyroid checked. And on this webinar, you're going to learn the right tests that should be ordered in order to have thyroid function properly evaluated, because most doctors do not order a full thyroid panel. Most doctors are just ordering a TSH or maybe even a free T4, and that's not enough. And that's why so many people are going undiagnosed or misdiagnosed with thyroid issues. So definitely anyone that has issues conceiving, they need to tune into this webinar, because thyroid is key for somebody to be able to get pregnant. And if the thyroid is not being properly evaluated, then we will never be able to fix that woman's fertility issue. But she can be fixed, and I'll discuss that on the webinar too. Involuntary mood swings is also another condition or issue, could be an issue of thyroid. I mean, I'm talking about like irrational mood swings, where just out of nowhere, there's no reason why a person should feel that bad or should be that emotionally affected. And so thyroid hormone is so important. Almost every organ in the body needs thyroid hormone in order to function. Almost every organ in the body. That's your brain, your heart, your liver, your kidneys, your muscles, your reproductive organs. It affects so much. And so knowing the truth about thyroid and how important thyroid is to our health is imperative. And that's why I do what I do. So definitely tune in this Thursday, 8 p.m. Central Standard Time, for you to learn the truth about thyroid and also how to resolve those issues. And so I'll be presenting patient cases of clients that I work with one-on-one. I'll give you their stories, what they've been through before coming to see me, all the doctors that they've been to, and then also show you how I've helped them to resolve their issues and improve their health. So you want to stay tuned the whole time. At the end, I'll do a live Q&A. And so I hold the questions to the end, but I'll be able to answer your questions at the end. And then I'll give you guys all an offer to work with me one-on-one, a special offer for those who wait until the end. So definitely tune in this Thursday, 8 p.m. Central Standard Time on Facebook Live on our page, and you'll be able to learn the truth about thyroid and know the truth about thyroid. All right, see you then. Bye.